Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Elizabeth Borjon. Elizabeth is a staff nurse at Washington Hospital Healthcare System.
As Luann mentioned, we're going to be talking about gastroparesis and its effects on diabetes. And again, my name is Elizabeth Borjon. These are just some titles, but pay no mind. I've been a nurse, like Luann said, for 11 years. I worked at Washington Hospital for 16. So I do work on medical oncology. So it's been, and I do supervisor as well, but this was a great way to learn some stuff and also get involved with the community. So I'm very happy to present for you guys. Okay, so I'm going to go ahead and go to the next slide. I'm just going to go ahead and start off with a basic definition via diabetes.org about what gastroparesis actually is. So gastroparesis is a form of neuropathy, and neuropathy is just a nerve dysfunction that affects the stomach. So the digestion of food may be incomplete or delayed, which results in nausea, vomiting, or bloating, and it makes blood sugar control very difficult, especially for patients with diabetes. So I want to give you a little bit of background as far as like the pathophysiology of gastroparesis. But the pathophysiology behind gastroparesis is the stomach mechanisms are impaired, which delay the gastric emptying. So the food isn't being absorbed and it's being delayed. So individuals with diabetes have a greater risk of developing this condition, and it can lead to hypo or hyperglycemia. So gastroparesis usually results from long-term uncontrolled diabetes for type 1 and type 2 diabetics, which causes that neuropathy. So damage to the vagus nerve decreases gastric emptying and results in poor glycemic control. So as you know, with diabetes, it affects so many different organs. And so that's why we want to make sure that we maintain good glucose control. So I want to provide you with some of the signs and symptoms of gastroparesis. So nausea is one of the most common. Bloating, early satiety means that you just get full after you start eating. You get full really quickly. With gastroparesis, you can also have fluctuating glucose readings, constipation and or diarrhea, fullness after meals, abdominal pain, weight loss or weight gain. And I just would like to remind you of the normal glucose readings before a meal should be 80 to 30, and the normal glucose readings 2 hours after a meal should be less than 180. And as you know, some of the signs and symptoms with a lot of different diseases can be very vague, right? So you have constipation or diarrhea. So it's kind of hard to say which one specifically points at a certain thing, or abdominal pain, which can be pretty generic as well, weight loss or weight gain. So really everybody is very different, but what we do want to focus on is the normal glucose readings before the meal and then after 2 hours after the meal. So if you're having any of these signs and symptoms, it's best to report to your physician. I wanted to also go over the treatment and symptom management for gastroparesis. Symptom management, maintain optimal glycemic control to reduce the symptoms of gastroparesis. And we do that by eating smaller, more frequent meals, eating a low-fat, low-fiber diet, maintaining hydration. And one of the things that they did say was increasing liquid types of nutrition. So if you're not able to tolerate specific foods, having them in like a smoothie or something would definitely help with motility. And water and hydration is definitely important. Alcohol and tobacco can delay gastric emptying. Usually we try to stay clear from those, and then also avoiding dairy products, which can decrease motility. Just to inform you, the main nutrition deficiencies in patients with gastroparesis are iron deficiency, vitamin B12, and vitamin D and calcium. So a lot of the times patients are already deficient in these, because sometimes it's really hard with diabetes to get a good overall nutritional status. So just make sure that you ask your doctor if you do need to take any supplements to help with that. And then there's also several different types of medications to mitigate any of the symptoms, such as nausea. So go ahead and talk to your physician to see if they would have anything available for you if you are having any type of symptoms. And again, they will do testing. And if anything, this will give you a little bit more of information of kind of what to look for, but hopefully, like Luann said, your blood sugars are in control and we don't have to worry about this. So I think we're good.